Hi guys, welcome back to the channel. In this video we're going to be learning about the second part of the hip bone, that is the pubis, and we're going to be learning about its muscle attachments and the bony landmarks. So yeah, stay tuned till the end of the video and let's get started. So before we begin, I'd like to recommend that you watch my previous video on the ilium before watching the video on pubis, because we move in a systematic order. We start from the ilium and then we'll move on to the pubis. So it's better if you watch the ilium first. So if we talk about the pubis forms the anterior-inferior part of the hip bone, and the pubis articulates with the rest of the hip bone's components like the ilium and the ischium at the acetabulum, as stated earlier. The pubis mainly has three parts. It has a body, right here. This is known as the body of the pubis. It has a superior ramus, and it also has an inferior ramus. The inferior ramus of the pubis, along with the ramus of the ischium, forms the conjoint ischiopubic rami. So we'll move in a systematic order. We'll start from the body of the pubis and then we'll move on to the superior and inferior rami. So the body of the pubis consists of three surfaces. It has a medial surface. This is the medial surface, and it articulates with the other hip bone, other medial surface of the other hip bone to form the pubic symphysis. It has a pubic crest right here. This is the superior border or the pubic crest, and laterally the pubic crest also possesses a tubercle. This is called the pubic tubercle. The anterior surface of the pubis is also called as the femoral surface, and the posterior surface of the pubis is also called as the pelvic surface. Moving on to the superior ramus, we see that the superior ramus extends from the acetabulum right here all the way to the body of the pubis. The superior ramus possesses three borders and three surfaces. So this is the anterior border of the superior ramus. This is the superior border right here, also called the pectineal line, and we have an inferior border right here. This is called the inferior border, and the inferior border also forms the upper part of the obturator foramen. The superior ramus also possesses three surfaces. Between the pectineal line and the anterior border, we have the pectineal surface right here. This is the pectineal surface. Between the anterior border and the inferior border, we have the obturator surface, and between the inferior border and the pectineal line, we have the pelvic surface. So if we talk about the inferior ramus is extending from the body of the ischium to the body of the pubis right here. This is known as the inferior ramus. The inferior ramus actually also joins the ramus of the ischium to form a conjoint ischiopubic ramus right here. This is the conjoint ischiopubic ramus. The inferior ramus has a superior border which forms the lower part of the obturator foramen, and we also have an inferior border. So moving on to the muscle attachments on the pubis, please note that the red color symbolizes the origin of muscles, the blue color symbolizes the insertion of muscles, and the green color shows the attachments of ligaments and joint capsules. So while discussing the muscle attachments, we'll move in a systematic order. We'll first start with the body of the pubis, then we'll move on to the superior ramus, and then we'll discuss the attachments on the inferior ramus. So on the body of the pubis, we see that we have a pubic tubercle. The pubic tubercle gives attachment to the medial end of the guinal ligament, as well as the ascending loops of the cremaster muscle also originate from the pubic tubercle. So the pubic crest right here, the pubic crest gives origin to the lateral and the medial heads of the rectus abdominis muscle as well as the pyramidalis muscle. The pyramidalis also takes origin from the pubic crest. So moving on to the muscle attachments, on the anterior surface of the body of pubis, we see we have the origin of the adductor longus in this angle. We have the origin of the adductor longus. Right here we have the attachment of the anterior pubic ligament. Also on the anterior surface we see that we have the attachments of several muscles. We have the origins of several muscles, and moving superiorly to inferiorly, we see that we have the origin of the obturator externus muscle. Then we have the origin of the adductor brevis muscle, and then we have the origin of the gracilis muscle right here. So on the superior ramus of the pubis, we see that we have the pectineal line right here, and on the pectineal line we have the origin of the pectineus muscle. We have the insertion of the psoas minor muscle. We also have the attachment of a tendon and a ligament. We have the attachment of the conjoint tendon, which is formed by the tendons of the internal oblique and the transversus abdominis, and we also have the attachment of the lacunar ligament. So the attachments on the inferior ramus, if we see the attachments on the anterior surface of the inferior ramus, we see that we have the continuation of the origin of the obturator externus, then we have the origin of the adductor brevis, and then we have origin of the gracilis muscle. Also on the pelvic aspect of the inferior ramus of the pubis, we have the origin of the obturator internus right here. So that pretty much wraps it all up for the muscle attachments and the features on the pubis. Hope you guys found this video helpful. If you did, please like, subscribe and share with all of your friends as much as possible, and stay tuned for the next video on the features of the ischium as well as its muscle attachments. And yeah, see you guys next time.